Good morning, everyone. Thank you for coming down today to another historical day here at Bristol Hospital. For those of you who don't know, I'm Chris Boyle. I'm the Director of Public Relations here at Bristol Hospital. So today's program, we are going to have some remarks from our three speakers up here at the tables. Kurt Barwis, our President and CEO, Bristol Mayor Ken Conkane, and Brian Chick, the Chief Operating Officer from the developer of the Ambulatory Care Center and Randina Healthcare Corporation. So we will start off with some opening remarks. First from Kurt Barwis, our CEO.
Thank you. This is really an exciting day for us. And as I was standing up here, I was thinking our past board chair said to me a couple weeks ago, we need to replace this podium. And it's been here, I think, since 1964. I think you're absolutely right. First, I just make a couple comments about the team effort that went into this, the players, Randina, Jones, Lang, LaSalle, and most importantly, the city council, and all the folks that really behind the scenes, worked hard to make this day possible. The board of directors of Bristol Hospital, their commitment to this community, and the employees, the staff, everyone working as a team. We would not be here today if everybody didn't pull together. So I can't say enough about how incredibly supportive, responsive the city of Bristol has been. I was asked to make a few comments about what's going to go in this building, and so first I'm going to ground those comments with the hospital's mission. The hospital's mission involves evaluating the need for services in the community and really working hard to make sure that we provide local access to services that are needed by the folks that we serve. We go through an incredibly difficult and long process of evaluating need. We actually buy all the claims data for all the services that are provided to the community. And then we step back and we look at kind of a balance sheet, and we say, well, here's what the community needs, and here's what the supply of physicians are, the specialists, the primary care physicians. And every 2 years, the board actually goes through a very deliberative process and comes up with a medical staff development plan. We've done that for years, and there's always opportunities, always deficiencies. We've had an extensively positive and exciting recruitment cycle over the last 6 to 7 years. We've actually filled in some of those deficiencies that we actually never thought we might be able to do. And we've expanded to really meet those needs. So very much grounded in our mission, our charitable mission, very much grounded in really trying to do the right thing for the community. So in this building, on the street level, is going to be physical therapy and lab services. And then on the second floor, you're going to have neurology and orthopedics. So orthopedics for us has expanded exponentially. We actually have a new physician who's been emailing me from out in Washington, a podiatrist who's joining us in August. We also have recruitment plans for an orthopedic hand surgeon. And we are busting at the seams here on campus. So we really have no choice to expand into a bigger space, a much more efficient space for those physicians. So they're going to be on the first floor with neurology. On the second floor, we'll have cardiology, urology. Urology has been an opportunity for us. I think we've been recruiting urology since the day I got here over 10 years ago. We are really excited to be able to announce that we've recruited a urologist, Kai Hemmerich, who is coming from the National Cancer Institute. He's been there for 8 years. This guy's credentials are impeccable. He will be joining our urology team, and we also have plans to recruit additional urologists in the next 2 years. So again, we actually don't have an office for Dr. Hemmerich, and so we're now struggling to find a space for him to go. In the interim, he will be here this year and then move into the building with everybody else. So endocrinology, our diabetic center, will move to the new building. Rheumatology, and I think I covered all the bases. Our diabetic center. And there will also be space to do community conversations, community education, and we have expansion space in the building. And one of the other specialties that we're actively recruiting is ENT. And we hopefully will be able to do that in the next year or so. So that's what's going in the building, and I'm going to turn the conversation over to Mayor Ken Conkane. Thank you.
Thank you. This is a historic day for Bristol. Little backstory. What really got me involved in politics was when the city bought the Center Mall. I was so upset that the city bought it. That really thrust me into politics, and here I am 10 years later dealing with the issue that got me into politics. It's pretty cool. You know, when Renaissance walked away, I called up Kurt in the car, and Kurt's heard this story a couple times, and it was a Friday night. I'll never forget it, and I had about an hour ride ahead of me, and I called up Kurt on his cell phone, and I think he was in his car too, and we talked for about an hour and said, hey, I know you're looking for some land. What do you think about going downtown? So we had a great long talk, and by the time we were done with the talk, we felt we had a deal put together. We were wrapping it up in a couple weeks, and then the lawyers got involved, so it took a little bit of time. But you know, today's a historic day. I want to thank Bristol Hospital and all the employees for stepping up to the plate. They took a desolate downtown, which we didn't know what was going to happen. No one was investing money down there, and they stepped up to the plate and are building, and I can't wait till you see it because I saw it a few weeks ago, an incredible building. This is going to be the showpiece for downtown. It's going to bring an average of 400 to 500 people downtown. Professionals, doctors, nurses, staff, and patients. And those people are going to need a place to go eat. They're going to need a place to go shop when they're here. And because of this, we are now talking to a second developer who's looking to develop on the parcel, take about 5 acres, and put up 4 to 5 two-story buildings. First floor is going to be retail. Second floor is going to be a combination of apartments and office space. So this one project has sparked the rest of downtown. We've met with a couple other developers that are looking at the parcel across from City Hall as well. So things are moving along, but things of this magnitude do take time, and we're hoping to have something solidified very soon. The city will be putting in a road this summer. You'll see the road infrastructure going through. The road is going to come in approximately where the old entrance to McDonald's was on Riverside Avenue. It's going to wrap around and come out on Laurel Street entrance. That is going to have a bus stop on it, so we're going to take the bus stop out of in front of where it is now on the corner of Riverside Avenue, and it's going to be inside of the land. We're going to see all new streetscape. The streetscape that's coming on Upper North Main Street will be brought down North Main Street and wrap around Riverside Avenue and then take a left up finishing off Main Street. Riverside Avenue, right now we have plans to make that a 2-lane road. Right now it's a 6-lane road. And on that, it's going to do things. It's going to slow down the traffic, make it more pedestrian friendly, which is what we want. And we're going to have angled parking, more on-street parking, which is our goal. So I'm excited about this. This is just the beginning. I know Kurt and the team are going to be hearing me screaming one of the shovels going in the ground. Rendina has been outstanding to work with. From the day one when we met them, they were flying back the next morning, but we had a meeting, I think 8 a.m. in my office with this whole team and sat down and really talked. So they've been outstanding to work with our lawyers. So this has been nothing but a positive experience with myself and us. Kurt and I exchanged a few words along the way, which is to be expected, but we always got done what we wanted to, and that's to be expected. So I congratulate Bristol Hospital, and I thank Bristol Hospital for stepping up to the plate.
So I just got to say one thing. Yesterday I was at the bank making a deposit right across the street, and all the tellers looked at me and said, "Oh my God, there's trucks over there actually digging holes in the ground." And they are. So they're already in the ground. So.
Great, thanks, Kurt. Our next speaker is Brian Chick, who's the Chief Operating Officer from Rendina Healthcare Real Estate. Brian's going to say a few words about the project, and then he will coordinate that we have 2 unveilings of kind of the entrance that's facing south and then the entrance that's facing north. And we will have a few special guests who are going to help us with that. So, Brian?
Good morning, everyone. I'm Brian Chick. I'm the COO of Rendina Healthcare Real Estate. We're a national real estate firm. We specialize in healthcare facilities. We've been in business for 30 years, and we've developed and acquired 7.5 million square feet of properties nationwide. We're here today because we were selected by the hospital. The hospital put their trust in us to be their partner on this project. This project has had a lot of focus, a lot of community focus. I think since I've been in town, I've lost track of how many times I've been asked what this is going to look like, so we're going to answer that question today. And then after that, the question will be, when's it going to be done? So we'll try to answer that question a little bit today as well. This project really, since we've been in town and been working with the hospital, we've seen that this project's been about vision. The city had a vision to repurchase and to position this property for redevelopment for the city, to spark the economy. The hospital has a vision for this facility to expand access to quality health care to the residents, and the community's had a vision because we've heard from residents. We've studied the polls. We saw the polls were taken and opinions were taken on what fits in downtown and what this should look like. And so we've spent a lot of time in the last several months doing a lot of listening because we're the new kids on the block here. So we've been listening to what that vision is and what people wanted to accomplish. There's been a lot of work going on behind the scenes with Kurt's team, with the city, with Justin. I see Justin here and staff. A lot of the providers are here today. They've been helping us on the design and with the board. And we appreciate the trust you put in us to work with you as your partner on this project. So I guess I would be remiss if I didn't thank a couple other folks who aren't here today. Kurt mentioned JLL. They've been a great partner throughout this entire process. They really got this running with the hospital. We had a great design coming in, a great thought for the design coming in, and so JLL has been a great partner. Again, the city and the city staff has been great partners throughout this. Our construction partner, O&G Industries, they're a local firm. They've been partnering with us and have helped us tremendously. The designs you're going to see were prepared by Davis Stokes Collaborative. They're our architect. They're a national healthcare architect out of Nashville. And we have CHA as our engineering firm. And then a local attorney, Jim Ziogas, is working with us on the land use. So I wanted to thank all those team members because an awful lot of work has gone into where we've gotten today. And you're going to see a lot more work in the days to come. As Kurt mentioned, there's some activity on site, and you're going to see a lot more activity pick up on site. So before we unveil, real quickly, timeline going forward. We're finishing up design. We've been working with the user groups and providers here at the hospital, and we hope to finish design up here through the summer and get our approvals done in the fall through the city and any of the state approvals that we need. The goal here is to be moving dirt and to break ground before the end of the year. So that's what we're pushing for. That's what everybody's working toward. And so that's the timeline we're on currently. So without further ado, we'd like to show you two renderings. I think Chris had mentioned the first rendering will be the rendering that is the south-facing rendering. So if you were standing in the intersection of Main and Riverside, this is the view of the building you would see from that
Kurt,
vantage
you
point.
want me to just flip over the back?
There we go.
And the thing I would point out, I guess, is first and foremost, we were going for a presence on that corner. We wanted to establish a presence on the corner with the building. And we wanted it yet to be pedestrian-oriented and have a pedestrian scale to it. So you'll see some of the materials that we've used, the stone banding on the bottom, the brick, the use of awnings, and the use of the enhanced glass on that street level. We're trying to give it that pedestrian scale and pedestrian orientation so that it has a downtown retail feel, even though it's a medical office building. So that's one of what we were trying to accomplish on this particular elevation as we looked at the project. Again, we looked at the designs and the polls that we're taking, and we tried to come up with a design that was in keeping with the character of what the community had shown us in terms of what they wanted to see downtown.
So as we unveil the next rendering, we are going to have John Lodovico, who's a chair of the building committee, Ed Henry, who's our executive director of our multi-specialty group, and Tiffany Fernandez, who is pretty much also leading this project.
This rendering is from the opposite side of the building. If you were looking back toward the building from the parking area that'll be behind the building, but essentially our front door. And some of the architectural features here, obviously, this is our patient-centered entrance. I mean, this is a canopy covered drop-off for patients to come in to the building. You can see we've used glass, a lot of glass throughout this building. Natural light's important for the use inside of the building for both the patients and the providers. A lot of the waiting room areas for the patients will be located on this side of the building where we've located a lot of the glass. There will be a cafe just inside the front door that'll service the patients and the employees when they're there. And there's a two-story lobby atrium space when you enter the building to give it a little bit of feel when you come in that there's an expanse to that to the lobby area.
That concludes our event this morning. We are going to take just a few formal photographs, and then I know our friends from the media will have some one-on-one questions they'd like to sit down with our guests. So in closing, happy Memorial Day weekend. We're always thinking of our veterans and their families, and thank you everyone for coming here today.